Hi, my name is Danielle White. This is my community plan presentation for my community health nursing class at Harding University. Access to care is important in keeping a community healthy. Community is defined as a group of people who share something in common, such as the area that people live within. The health of a community can be determined by examining the resources it offers to its community members. Access to healthcare, food, and preventative care is important for a community's overall health. Assessing a community is important to know what they have an abundance of and what they might be lacking. This can help to develop plans within a community for things that might be needed. Cardiology care is particularly important. It's the leading cause of death in the United States, according to the CDC. The Madison area in Dane County is no different than the rest of the United States, and the demand for cardiology care is increasing. The increased demand is putting stress on an already overwhelmed system, creating long wait times for patients and multiple visits that are unnecessary. Access to care needs to be addressed within the Madison-Dane County area. Writing and implementing a triaging process is an option to create better access to new cardiac patients. Collaborations between providers, nurses, medical assistants, schedulers, and community members will create a healthier community. Community can be defined as a group of people living in the same place or having a particular characteristic in common. Dane County is a large community with 536,416 people living within its borders. Madison, the capital of Wisconsin, is located near the middle of the county. The majority of Dane County's resources are actually within the Madison and surrounding areas. There are 407 people per square mile living in Dane County. Of that, 82.5% are Caucasian. The average income per year is $67,000, and 11.3% live at or below the poverty line. 5% of the population of Dane County is without health insurance, and 95.6% have high school diplomas, and over 50% have bachelor's degree or higher. The high rate of education can be attributed to the University of Wisconsin being located in the heart of Dane County. According to the Department of Wisconsin Health Services, 3,587 people die each year from chronic ischemic heart disease in Dane County. There are 3 state-of-the-art cardiac hospitals in Madison. There's the University of Wisconsin-Madison Hospital, UPH Meriter Hospital, and SSM Health St. Mary's. Last July, the University of Wisconsin-Madison and UPH Meriter Cardiology became partners. This partnership was created to increase access for patients throughout Dane County. In Dane County, 28.5% of the population is obese, 7.8% have diabetes, 8% has atrial fibrillation, 12% have heart failure, 39.5% have hyperlipidemia, almost half of Dane County's population has hypertension at 48.5%, and 22% have ischemic heart disease. These cardiac conditions in Dane County are trending up at an alarming rate, thus increasing the need for new patients to be seen in cardiology. The influx in patients will need to be addressed before it becomes a serious issue. One solution is triaging new cardiac patients to be sure that they are appropriate referrals and that all testing that is pertinent is done prior to their visit with cardiology. This will help to reduce the number of wasted visits where a physician does not have sufficient testing and the patient has to come back for testing to determine the next steps. The process would improve efficiency and would hopefully increase patient satisfaction. In analyzing the previous data from Windshield Survey and from the observations in the cardiology clinic, it was abundantly clear that something needed to be done to create better access for new cardiac patients. The combination of cardiologists leaving, not being replaced, and an influx of new patients, our clinic started to struggle to get patients in to be seen in a timely manner. The issues above create long wait times and the potential for complications while waiting, preventable hospitalizations, and even possibly death. With the concern of non-established patients waiting in the wings to be treated, an idea emerged to start a triaging process. There are many community partners to aid in creating access and helping cardiac patients to better understand their disease and prevention. Unity Point Health Meriter is currently partnering with the University of Wisconsin-Madison Cardiology Group, the Electrophysiology Group, and the Faint and Fall Clinic. Patients who are now under the umbrella Quartz can be seen either at the Unity Point Health Meriter or UW locations. The partnership was created for patients to have a choice and to have better access to specialty providers. Since the partnership in 2017, we've seen a large influx of new patients. We continue to work together to create better access for patients and their family. Pulse Point is an app that was created to help victims of cardiac arrest by alerting via the app to trained CPR and AED personnel in the event that might happen near them. The application also allows users to locate the nearest AED. This app was promoted and used by many throughout the Meriter organization. Attached is a short video with more information about the application from its creator, Richard Price. The Wisconsin Department of Health Services has information on their website to provide education to patients living with coronary artery disease. We partner each year with various organizations and other hospitals within the area to raise money for the American Heart Association. At this event, there's education that's provided to promote wellness, life-saving skills such as CPR and AED training. The money that is raised is also given to the American Heart Association, thus helping decrease the rate of coronary artery disease. All of these resources and community partners help to create a healthier community through access, education, and life-saving applications. Lack of access to healthcare, specifically getting a cardiology consult, can increase the risk of hospitalization. Community members who are in need of specialized care and have been referred to cardiology need to be seen in a timely manner. A delay in care may result in complications, hospitalization, and even death. Addressing a patient's access to care is important in keeping a community healthy. The increase in population and increase in chronic disease and access to new technology are driving the increased demand for health services. The community is at risk for hospitalization among patients with limited access to cardiology care related to a lack of resources. The Community Health Plan was created through the gathering of data, analyzing that data, and formulating a community health diagnosis using the information. With creating a plan, many partnerships will need to be fostered for the triaging protocol to be successful. Strong, lasting partnerships are created through trust. Without trust, partnerships will not thrive. Cross-sector collaboration and partnerships are essential components to health and well-being of a community. Through a partnership with physicians, nurses, managers, and most importantly, community members, access can be increased at the Unity Point Health Meriter Cardiology Clinic. Implementing the triaging process will take time. Currently, there is a meeting scheduled in May to talk with business services to present the idea. Once the approval is given, the process will go ahead with trialing. 2 nurses will be selected to head the trialing of the triaging process. A triage manual will be given to the nurses to use when triaging. 2 examples of the triaging have been made, one with chest pain and one with new onset of atrial fibrillation. Others will be made as the approval is given. The triage manual will serve as a guide. Physicians will also assist with the triaging process. If at any time nursing staff has questions, the physician will be given all of the information to help with the decision making. If testing is needed, the nurse will reach out to the referring provider's office and advise that they should order the testing. Any additional education that's needed for nursing staff will be given prior to starting the triaging process. A meeting will be held prior to its implementation to go over what will be happening, when it will start, and to answer any and all questions nursing staff might have. A meeting will also take place for the entire clinic to announce the new idea of the trialing process and what everyone's roles will look like within this new process. Questions will be answered and concerns will be noted prior to the process being started. Evaluation will be done 2 weeks after starting the process. It'll be 2 nurses that will be evaluated on how they think the process is going and how it could be changed to make the process more efficient. Changes will be made, if applicable, and the process will continue for 2 more weeks. A survey to new patients will be sent out to see if the process was smooth for them and if any changes should be made to make the process better. After 1 month the triaging process has started, it'll branch out into all nursing staff on the cardiology line. The evaluation process will continue as new nurses start triaging. Meetings will be held every 2 weeks to go over the processes and any changes that might need to be made. Everyone at the clinic will be encouraged to come and to bring any concerns to the table. Lack of access to healthcare puts patients at risk of preventable hospitalizations due to complications created by long wait times. Improving access to care is important in keeping communities and individuals healthy. Using a triaging process to increase access with the help of partners, like primary care physicians and nurses, can help relieve the stress on an already strained system. Triaging is only a temporary fix, and the issue of access will need to be addressed with hiring more providers for the increase in demand for cardiology. Until more cardiologists are hired, this will hopefully prove to be a successful process to increase access for new cardiac patients.